Yes, Cynthia. Do you know how many surgical disciplines there are in Kenya?
Not the exact number.
But can you guess? Just give a quick guess.
Maybe 10.
10? Ah, okay. Do you want to find out the exact number? And their types?
Yeah.
And probably see the students who are taking the courses?
Yes. Actually, I changed my mind.
Why?
Maybe like 6.
Okay. Close enough, but we'll see.
Okay.
So the easiest way to think about it is that you can have surgery for every part of your body, practically from your head to your toe. Head, shoulder, knees and toes, knees and toes, knees and toes. Now the disciplines have been divided to cater for all these parts of the body, and those are the surgical disciplines that we're going to talk about with the help of my classmates. For purely selfish reasons, I'll start with the knees and toes coming up. So knees and toes will encompass the legs and all the limbs per se. So who takes care of the knees and toes?
Hello, my name is Dr. Maureen Wanjao. I am an orthopedic resident. I'm here to just talk about why orthopedics and what it's about. Basically, it's a branch of medicine that entails the study of the human skeletal structure. What is known out there for orthopedic surgeons is that they tend to correct deformities with bone, the joints, basically the human skeleton. And why, in a nutshell, I would say is that they restore functionality. So I love the fact that I'm able to see results quickly in most of my patients in terms of repair and reconstruction. We're able to take a patient, for example, who was previously not walking, and after surgery, corrective surgery, they're able to walk in a matter of days. So I love that about orthopedics, and it's quite fulfilling.
Whoop! Change in scenery, keep you guys guessing. I may have been chased out of the park because of jumping up and down unnecessarily. Anyway, orthopedic surgery is a very practical course, and I was really drawn to it. Case in point, look at this orthopedic registrar serving food and realizing that the food has a lot of bones in it. He's quite happy. A simple life.
Hello, my name is Dr. Kasi Moshemi. I'm studying MMed General Surgery. The role of the general surgeon is to provide surgical care to the whole patient. It involves making a diagnosis, pre-operative care, operative care, and post-operative care, and the surgical management of the alimentary canal, the abdomen and its contents, the pelvis, the breasts, and other soft tissues. Hoping to see you soon. Thank you.
And to look at your fans.
And then I'm thinking, should I look at the camera? You've just ambushed me at 5 a.m.
Hi, Steph.
Hi.
So what are you doing in school?
I'm doing pediatrics.
Pediatrics. So are children or pediatric? Is the pediatric population, are they small adults?
No, they're small. They're better than adults. But actually, I would rather say adults are big babies.
So when general surgeons, like let's say an adult gets an interception or a blockage of the alimentary canal and general surgeons come in, is it the same general surgeon who treats children for the same condition?
Sometimes,
but
because
mostly,
that's what's available.
Ideally?
But ideally it's the pediatric surgeon.
So there's a pediatric surgeon?
There is a pediatric surgeon.
Who treats children for conditions that affect children and that a general surgeon would treat adults for?
Yes.
Hi guys, my name is Dr. Kipaton. I am a pediatric surgery resident. I am also a part-time butcher.
So do they normally just deal with beauty?
Hi guys, my name is Dr. Wanjiru Mugereri. I'm a plastic, reconstructive, and aesthetic surgeon in training. So, plastic, reconstructive, and aesthetic surgery has two main arms. You have the aesthetic or cosmetic arm, and then there's the reconstructive arm, which is the bulk of the work actually, that entails trying to restore form and function where this has been lost. Yeah. Yes.
So I did commandeer a urology resident to give us a piece of what urology entails, but he was unable to come through. He was otherwise indisposed. Regardless, we are committed to bringing information to you guys, and we did improvise, so here is what we have. Cynthia, how's your shopping experience?
It's very frustrating.
Kindly read the messages that I've sent you.
Okay. My name is Dr. Esiru. A resident of surgery in urology, a discipline that gets to the bottom of ailments that ravage the urinary tract system, which are the kidneys, ureter, urinary bladder, and urethra, and also aspects of the male sexual health. Save for the male sex problems, the rest cut across. Female sexual stroke productivity, should be reproductivity, is gynecological.
Okay.
Yeah.
I hope you have a very fruitful shopping experience. So many clothes to pick from.
I really hope so too.
MED urology entails surgical management of the plumbing system. For males, it also entails the reproductive health aspect. However, for women, the reproductive health aspect is catered to by the obstetricians and the gynecologist. So we don't have classes with them. That's why I don't have one of them featured. The next discipline is the people who normally deal with the heart and all the blood vessels in the body.
Hello, I'm Dr. Cynthia Oj. I'm currently pursuing a master's degree in thoracic and cardiovascular surgery at the University of Nairobi. So my field involves surgical management of ailments involving the heart and the great vessels, the esophagus, the lungs, and the veins and arteries of the body. A few of the common surgeries that are done in my field include coronary artery bypass surgery, heart valve surgeries, repair of congenital heart defects, angioplasties, insertion and removal of chest tubes, just to mention a few. Thank you. Have yourself a beautiful day and avoid heartache.
By the way, are you guys subscribing? Never mind. I'm avoiding heartache. As we move higher, we get to the throat, to the ears, and the nose, and this is the discipline that deals with this aspect.
Hi everybody, my name is Dr. Beo Pauline Sisingi. I'm currently studying MED ear, nose and throat surgery in the University of Nairobi, and it entails learning the surgical management of conditions involving the ear, nose and throat. It can either be infective causes or non-infective causes like trauma and cancers. The aim of this training is so that I become competent in surgical issues involving the ear, nose and throat, and also to be able to handle potentially life-threatening matters. It's quite a challenging course. It's not easy at all, but so worthwhile.
Well, these young people know how to clean up, eh? Just look at this next one.
I'm Christian Mulinganya, medical doctor from DR Congo. I'm undertaking my master's degree in surgery, precisely in ear, nose and throat, head and neck surgery. My learning and training include the learning of surgical management of the diseases of the ENT related fields. That includes the surgical management of recurrent ears infection, deafness, recurrent sinusitis, adenoiditis in kids, and also voice problems. For my hobbies, I love to play basketball and piano, and also I like to read some magazine about business and entrepreneurship.
These two areas are touched on by dentists. So when dentists come to do their masters in surgery, these are the two disciplines that they normally come to.
Hi, I'm Dr. Ochit Shalin. I am studying MDS, oral and maxillofacial surgery. It involves the learning of surgical management of craniofacial deformities, craniofacial trauma, and any other corrective surgery that may be required in the jaws and even inside the mouth. It's a very involving course, but it's also very gratifying.
I have to admit, I also didn't know this surgical discipline exists until quite recently.
Hi, my name is Dr. Patel Parina. I'm studying periodontology and implantology. It basically entails surgical procedures of the periodontium, which is the tooth supporting structure. It's a very engaging and practical course.
And yes, it has more than one student.
Hi guys, I'm Dr. Jane Otido from the University of Nairobi. I'm doing a Master's of Dental Surgery, specializing in periodontology. Periodontology is about support of the tooth, that means the gum, the bone. It takes 3 years. I'm in first year, hopefully going to second year. Yeah.
Finally, we crown it with this discipline. The head of the family. Nope, I'm kidding. Though most people feel like they're an arrogant bunch, they're not really arrogant. Though they're very disciplined and dapperly dressed most of the time. So just listen in.
Hello, my name is Dr. Ridwan Ibrahim. I'm a medical doctor studying postgraduate at the University of Nairobi in Master of Medicine and Neurosurgery. That involves taking care of the diseases that occur in the brain and the spinal cord surgically, and I'm from Somaliland.
Hey, Bill, I'm in the mood for a switch up. I hit the function, hit the rose till I hiccup. I hit the stage and leave with money that's a sticker.
So even as I edit this video, as I come to the tail end of the process, I want to thank all my classmates who were kind enough to send their videos in as much as it was uncomfortable for them to be in front of the camera. Thank you very much. Just a disclaimer, these are not all my classmates. Every thematic unit has at least 8 people, so we are around, let's say 80 in number, 80 to 90 in number. Hopefully as we move forward, I will enlist them in more day-in-the-life videos and you'll see them up close and candid. Everyone is a doctor, including the pediatric surgeon, so please hit the subscribe button if you are excited about the content that will be coming your way soon.
Yes. Actually, I changed my mind.
Why?
Maybe like 6.
Okay, close enough, but we'll see.
Okay.
Guess she should have stuck with 10. Doesn't she know that she could have counted her fingers?
Hey, Bill, I'm in the mood for a switch up. I hit the function, hit the rose till I hiccup. I hit the stage and leave